Good health and welcome to today's edition of About Health, sponsored by the African American Wellness Project. Today's program is on the Affordable Care Act, so-called Obamacare. We're going to find out what's in that act and how we're doing in rolling it out. Let's begin our discussion. It's only fitting that we begin our discussion of the Affordable Care Act by talking with Dr. Ennix, who from the very beginning of the act has been a solid advocate and explaining to people what their options are, explaining to people about the value of the act, and his work in this community has been so valuable to so many people. So thank you for joining us.
My pleasure, Michael.
Tell us, first of all, why you're so excited about the Affordable Care Act.
That's a good question. I think that my interest and excitement first started a number of years ago when I traveled abroad, particularly to Paris, France, and learned that even though we use the very same instruments, the very same techniques, that the cost of open heart surgery in Paris was so much lower than it is here in the United States. And it rather piqued my interest because I knew then, as I know now, the quality of their medical care is every bit as good as ours, if not better. And that's how my interest started. I would say that I came to the realization that medical care should be something that all Americans have, just like education. It was some 200 years ago when the decision was made in this country that it would be better for society if everyone was educated. I think now that same thinking is coming to bear with regard to medical care, that we would be a better society if everyone had quality health care available to them. And that's why I'm excited about the Care Act. Some 45 million Americans have been uninsured through the years. A very, very large percentage, 17% of our society has been uninsured. And it has been known for a number of decades that people who are uninsured, it is related to poverty. And in this country, being poor should not be a disqualification for getting good health care. And so what the Affordable Health Care Act does is bridge that gap between those people who have insurance and have access to health care through their employer and those who do not. There have always been a group of people who could, well, not always, but since the Medi-Cal Act was passed, there have been people who had access through Medi-Cal. And of course, there have been people who have had access through their employer. But there has been a large number of people between those two extremes who have not have access to medical care, and that's because they cannot afford medical care in most instances. And it is that group of people who are in particularly targeted by the Affordable Care Act. But the fact of the matter is, I think it is lost on so many people that the entire population benefits. Health issues have been the number one cause of one losing their assets. And particularly if a person has had a condition such as diabetes or such as heart disease, then the insurance company has had the right heretofore not to cover them. And so if they get sick, it can ruin them. It can ruin the individual, it can ruin the entire family. And so now with the Affordable Care Act, that cannot be. But in addition to that, there are many other goodies.
But before we get to that, I think what many people in this country don't understand is that health care has been dragging down our economy for a number of years. And when we talk about the Affordable Care Act, everybody focuses on the specifics of the act, and we will in the second phase of our program. But it really does, you make such a great point, that the cost of health care was dragging this economy down. And unless we got a hold of those costs, and not only that, it didn't guarantee us quality health care, did it?
No, no. And you know, I like to use education as a parallel. It was clear, it has been clear over the past 200 years that ignorance drags the economy down.
Ignorance drags everything down. But go ahead.
Yes. And so it is clear to me that a healthier population will add to our economy. It will add to the growth of our economy. I am absolutely convinced of that. Heretofore, healthcare has cost this economy some 18% of the gross domestic product. Now, right now, there are signs that that is beginning to decrease.
Our discussion is on the Affordable Care Act. We'll continue our discussion with Dr. Ennix and talk about the specifics of the act right after this.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician.
I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because, we don't know everything. And, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
Before his injury, John Bennett was a career soldier. While serving in Iraq, he was shot by a sniper.
Stepped out, turned back towards the Humvee, and as soon as I did, I got hit. It shattered 2 vertebrae and fractured another one. I ended up losing my right kidney, my spleen, my colon, and half my pancreas.
Paralyzed Veterans of America got us our benefits.
I helped them fill out the forms. I hand carried the forms over to the VA and walked them through the system.
You're just trying to survive, and they help you along the way.
It's very nice to see when your work pays off and you're very successful in it, because you can see the change in that veteran.
Him starting a taxidermy business is accomplishing something every day.
I get to get up, go to a job, and do something that I enjoy. I'm glad to be back to work.
To learn more about Paralyzed Veterans of America, visit pva.org.
Be the hero. Be the game breaker.
Be the turning of the tide.
Be the guiding light.
Be the difference.
Be the difference. Be the difference maker. Be the one.
Be the one to save a life.
Patients with life-threatening diseases of every age and race
are searching for a marrow match.
Join the Be the Match Marrow Registry.
You can be the one.
Be the one. Be the one to save a life.
Welcome back. Our discussion on the Affordable Care Act continues with Dr. Ennix, an early and effective advocate for the Affordable Care Act, to talk about some of the specifics of the act. What can people expect?
Number one, we can expect a healthier population. Okay? Overall, we can expect that healthcare will account for a less amount of money than it has in the past. But specifically, you take here in the state of California, we have what's known as Covered California. Now, Covered California is a what's known as a marketplace, even though I don't in particularly like the term marketplace, except for the fact that it denotes transparency. What it implies is that choosing an insurance can and should be just as easy as going to a supermarket and choosing between fruits. In other words, complete transparency where you can compare apples with apples. And that's wonderful because you can select an insurance, a coverage that's tailor-made for you.
Now, what are some of the benefits? What could people expect? I know it's not just the insurance. Can you go through some of those?
Sure. It's important for everyone to understand that the insurance available for people who register on Covered California is the very same insurance that people get through their employer. High quality insurance coverage. The difference is, if you get it through Covered California, you can get help from the government if you qualify to get help from the government. Now, with that in mind, in terms of the benefits are the same as anyone else would get. A hospitalization, emergency care,
mental health?
Yeah, of course, mental health, pap smears, immunizations, and the whole gamut of healthcare needs.
And in fact, each insurance company is required to have certain, metrics that they have to meet. I mean, you can't just put an insurance company on the exchange. They all have to have certain things as part of the coverage.
The key here is transparency and standardization.
What I like about what you're saying, that each insurance company in the exchange has to have a full range of services. It can't just be a service here, a service there. Is that correct?
Not only is that correct, but two things are important: transparency and standardization. That is to say, that each of the insurance companies that agrees to be on the exchange must do the same thing that all the rest of them are doing. They must be identical. The product must be identical in the main in terms of what it offers. Now, there are differences in each panel of coverage. There is a platinum, a gold, a silver, and a bronze. The gold covers about 90% of your cost as a consumer. The bronze will cover 60% of your cost as a consumer. The gold, the consumer pays more. The bronze, the consumer pays less. But all of the plans are identical, pretty much, with the exception of the doctor and the hospital. In other words, to put that another way, if you want to assure yourself of getting the doctor that you've had all along, then the higher cost plan may be the one for you. But on the other hand, if you look at the plan, it could very well be that your doctor is on that less expensive plan. But keep in mind that if you get the less expensive plan, if you do need health care, then your copayment will be more. But also keep in mind that if you are 30 or 35 or 40, that may not make you any difference. But if you're 65 or 70, maybe it will make you a difference.
And I think that in spite of all of the early rollout problems, certainly covered here in California, we did quite well, didn't we?
We have done extraordinarily well. As a matter of fact, to date, it is estimated that over 12 million people have signed up. If you look at the state-run as well as the federal run plans, as well as look at the expansion of Medi-Cal, that's extraordinarily important. It's Medi-Cal in our state, Medicaid in other states. But with the expansion of Medi-Cal, and what do I mean by that? Heretofore, you could qualify for Medi-Cal only if you earned a certain level. Right. But now that level has been expanded to 136% of the federal poverty level.
Well, Dr. Ennix, I personally want to thank you for your advocacy, the fact that you've been going around explaining this act. I remember you saying to me when this act first occurred, even before we talked about the uninsured, you said what a pity it was that we didn't have insurance for everybody. And now that we've had this opportunity, you've done a great job. Thank you very much.
Well, thank you. Thank you. It's been my pleasure, Mike.
All right. We'll be right back.
I'm on a mission to spread the word about COPD, the only way I know how, through music. COPD stands for chronic obstructive pulmonary disease, but it's sometimes called chronic bronchitis or emphysema. It's a lung disease that takes away your ability to breathe.
4 minutes, Billy Ray.
COPD is the 4th leading cause of death in the U.S. and kills 1 person every 4 minutes. My grandfather suffered from symptoms of COPD. Many people don't find out until the disease is already in its late stage. And I have to try to raise awareness of this serious disease. Because if you detect it early, there are steps you can take to manage your symptoms. I'm Billy Ray Cyrus, and I drive for COPD. Anyone age 35 and older who has smoked as little as 100 cigarettes could be at risk. Looks like people are starting to get the message. Take action today to breathe better tomorrow. Visit driveforcopd.com today to take the 5-question screener and talk to your doctor.
The Coast Guard Foundation gave me funds to attend school. During that same time, my wife was pregnant. The foundation's grant allowed us to buy food, diapers, clothing.
Coast Guard Foundation really helps us to keep in touch with our families. They make an impact, and it leaves an impression that you don't forget.
I would like to thank the Coast Guard Foundation for helping out when times were tough.
Because sometimes, even the rescuers need to be rescued. The Coast Guard Foundation, proudly supporting the men and women of the United States Coast Guard and their families. Find out how you can help at rescuetherescuers.org.
If you're not planning on getting pregnant now, you should know that foods rich in folic acid like white bread and leafy greens can help prevent some birth defects before you even know you're pregnant.
Our special guest, Dr. Noah Aboelata, who is a family practitioner, director of the Roots Clinic in Oakland, California. Thank you for joining us.
Thank you for having me.
You know, one of the things about the Affordable Care Act, we're also excited that people have insurance, but actually you and your Roots Clinic and your doctors have to deal with it and have to work with the patients. How are you feeling about it?
Well, for us, we're a community clinic located in East Oakland with a large population of low-income people. So for us, it's been a tremendous opportunity to get people into care for the first time. It's definitely not without challenges, though. People are coming into care sicker because many of them haven't had a doctor since even childhood. And of course, there are a lot of challenges around just the enrollment process itself.
When you talk about the population you're seeing, what's different about the Affordable Care Act that allows you to see people who previously have not had insurance? Many people think that low-income people have always had Medi-Cal or some form of insurance, but obviously that's not true.
Correct. So for women who are pregnant or had dependents who are low income as well, or blind and disabled, all had coverage under Medi-Cal previously. But now we have this population of so-called able-bodied adults without dependents. Many of them are men, and they are now eligible for coverage under the Affordable Care Act, where they previously had not been.
So the term we keep hearing about in regard to this is expanded Medicare.
Correct.
Medi-Cal. What is expanded Medi-Cal, other than the fact that it covers a different population, more people? What does expanded Medi-Cal mean?
So that's primarily what it means, is that it is expanded to cover more people. There are some provisions in the Affordable Health Care Act that are covering more preventative services. So that's the other meaning of the expansion.
Now, when you start to talk about the administrative pieces, it's still an insurance plan, right? I mean, so how are you able, is it more paperwork? Are you able to deal with it more effectively? Do you feel that in total you're able to give a better quality care than before the Affordable Care Act?
So I think primarily more people are presenting for care, which is the best part about it. So people who did not have insurance before usually wouldn't show up for care unless they were very sick, and then they would pay on a sliding scale. Roots Clinic is actually also an enrollment entity, so that means that when people come in, we can get them signed up for Medi-Cal or even through the exchange. And so that's been a huge benefit, but it is definitely an extra burden on the clinic because there is quite a bit of paperwork that we don't necessarily get compensated for doing. But it does get people enrolled, and then they're able to choose a plan, and then they're able to get covered. There have been a lot of bumps along the way. So people don't have coverage day one. They're having to wait. There's a huge backlog, and so people are still in this pending status, which gives them a lot of uncertainty still. But we're trying to ask people to just be patient and hold on. This is the most sweeping change that we've had in healthcare since Medicare was enacted. So this is major, and we feel like things will get smoothed out over time.
We're starting to hear that, at least in some parts of the state and in some parts of the country, that there's just not enough doctors to see all the new people that are coming into the system. Are you starting to feel that, and why are we so under-resourced?
Yes, we're definitely feeling that, particularly for low-income patients. So even before the Affordable Care Act, there were not enough doctors that were willing to see low-income Medicaid patients, and that's because Medicaid comes with a very, very low reimbursement. And the patients tend to have more complex issues going on because of poverty and other issues that they face. So for the most part, doctors are not very interested in seeing the Medi-Cal population. And we really feel that not enough was done before the Affordable Care Act was rolled out to ensure that there would be an adequate workforce that was willing to take care of low-income patients in particular. We do hear that there's a shortage even for not low-income patients, but certainly in our communities we see that there are long wait times at some of the public clinics and the clinics that previously were mandated to take care of uninsured patients. And the number of doctors in the community that are willing to see Medi-Cal patients are now being somewhat overwhelmed, honestly, by the numbers of Medi-Cal patients that are coming in. And it does pose a little bit of a moral challenge for those doctors because there's only a certain number of Medi-Cal patients that a practice can typically handle and still survive, because it's pretty well known that if you're going to see Medi-Cal patients, you're going to do that at a loss.
Now, when you talk about one of the unintended consequences of the Affordable Care Act is that there are basically a number of different safety nets for doctors across the country, really. I mean, the community clinics obviously have provided a tremendous safety net, but there are something called essential community providers. There are safety net providers who are not in a community clinic or who are not associated with some of the more established institutions. And some of them are feeling left out. Just kind of explore that issue with me of the safety net that doesn't include the community clinics, and what's happening to some of these doctors and how that process might be corrected.
So I think you're speaking of a sector of the safety net that we feel is really critical. And it was critical before, but it's even more critical now after the Affordable Care Act. And that is this independent, small community providers that have cared for low-income people, sometimes for generations, that are not part of the federally qualified health center system or the county health systems. But these are, by definition, safety net providers that are incredibly important. They're culturally competent points of access to care for low-income people. And for the most part, they have been left out of some of the provisions that were put in place in the Affordable Care Act that allowed for additional resources and funding for the other sectors of the safety net. And so for us, we've actually convened a coalition of these, what we call community-rooted providers, who are essential community providers, called Roots Alliance.
One of the things that's concerned a lot of us around the state is one of the unintended consequences of the Affordable Care Act, even though we're all very supportive and happy that people get insurance, is that some physicians who've traditionally formed a safety net outside the community clinic system have been left out. Could you discuss a little bit of that with us?
Yes, I think that there is a sector of the safety net that has traditionally provided care to low-income communities. They're often providers of color who have set up practices in their own communities and really wanted to provide the care, and have been doing so oftentimes at a loss because of their own commitment and their own mission. And unfortunately, this sector of the safety net has not really been recognized or supported. And now that we have rolled out the Affordable Care Act, this part of the safety net becomes very critical, really, to the success of the ACA, because without these points of access being really shored up and supported, we will have an even more difficult situation with access to care, particularly for low-income people. So it is important that the small independent safety net practices survive, and it's important that they that someone comes in to take their place, new physicians come in, and that really that we band together and speak with a unified voice to advocate for ourselves and on behalf of our patients.
So we're really going to have to follow that. Dr. Noah Aboelata, thank you very much. And thank you for joining us on this edition of About Health. Remember, health is your biggest asset. I'm Dr. Michael Lenoir. We'll talk again.